Good evening, everyone. A very warm welcome to the free webinar series, Anubhava, the second series. Myself, Dr. Minu Krishnan from MedMap Medical Services, and I will be moderating today's session. First of all, thank you all for joining us here today. It's a moment of joy, actually, to see you all here, and I warmly welcome each one of you to the session. So getting into today's session, the Anubhava, the free webinar series, sponsored by Dr. P. Alikutti's Ayurveda Pharmaceuticals Cortical, organized by Ayurveda MAP and initiated by MedMap Medical Services. So before getting into our today's session, I would like to introduce our sponsors. Dr. P. Alikutti's Ayurveda Pharmaceuticals Cortical. It has been established as a part of Dr. P. Alikutti's Ayurveda and Modern Hospital Cortical in 1965 to meet in-house requirements and for special formulations for the founder. And this pharmaceuticals produces major classical preparations and 50 plus proprietary products in this well-equipped manufacturing unit, which is located at Maravatam, Kottakkal. And it is a GMP certified production facility which manufactures classical preparations like Kashaya, Arishta, Asava, Lehya, Shurna, Taila, Krida, etc. And it is established having a history of over 6 decades of expertise. Dr. P. Alikutti's Ayurveda Pharmaceuticals have become pioneers in the manufacturing with FSSI, ISO, and SET certification. And they also have the facility for third-party manufacturing and private labeling, enabling the customers to procure their products anywhere from the world. And they also have all kinds of medical accessories and orthotics products which are available at a very competent rate. So next, regarding ourselves, the organizers and the initiators, the Ayurveda MAP and MedMap. Ayurveda MAP is recognized as a leading platform for Ayurveda skill and education development throughout India. And we offer a broad spectrum of postgraduate diploma programs and certificate programs to educate Ayurveda professionals to uplift their skills, to find their niche, and to excel in the career of Ayurveda. And we have been established with over 8 years of experience in the education sector. Ayurveda MAP has solidified its position as a premium platform for Ayurveda training courses, being the pioneer in the course of postgraduate diploma in Ayurveda cosmetology and trichology. And we have a group of faculty members and team to empower the individuals who having aspirations to convert their dreams to excel in the career of Ayurveda. And starting from 2022, Ayurveda MAP brand has been seamlessly integrated with MedMap Medical Services. And now this Ayurveda MAP and MedMap function together as a solidified entity. And this integration facilitates enhanced coordination and synergy between the expertise of Ayurveda MAP and the comprehensive medical services provided by MedMap. In short, this collaboration enables Ayurveda MAP as providing education for the Ayurveda professionals and MedMap Medical Services providing integrated healthcare services that serves humanity. These are the upcoming courses that we offer. Professional Diploma in Orthopedics and Sports Medicine Rehabilitation in Ayurveda, which is a 6-month course. Professional Postgraduate Diploma in Clinical Cosmetology. Vibha, it is a session on Ayurvedic cosmetic preparation. Diploma in Ayurveda Cosmetology is a 6-month program. Siddha, it is a product development workshop. So these are the upcoming courses. So as the time is limited, I am not explaining in detail regarding the courses. If you wish to know more about our courses, please contact our team. So coming to today's point of discussion, the management of osteoarthritis, clinical approaches, and case-based perspectives. For the topic you all are eagerly waiting for. And we have our faculty, Dr. Remya ma'am with us. Welcome to the session, ma'am. And a little about our speaker, I would like to introduce. Dr. Ramya Alakkal, ma'am is the professor and head Department of Panchakarma, Ashtangam Ayurveda Vidyapeetham Vavanur, and ma'am has graduated from Cortical Ayurveda College and postgraduate from Government Ayurveda College, Trivandrum, in subject of Panchakarma, and ma'am is also pursuing PhD at Kerala University of Health Sciences, and ma'am also served as tutor at Department of Kajikilsa at Parshanikada Ayurveda Medical College, and also demonstrator at Amrita School of Ayurveda, and also ma'am has served as assistant professor at Department of Panchakarma in Parshanikada Ayurveda Medical College, and ma'am also served the role of specialist consultant in Ayurvedic neurology at Ayurveda Hospital, Neurocare and Rehabilitation at Indira Gandhi Cooperative Hospital and Natural Touch Ayurveda Clinic at Kannur. And ma'am is the author of multiple acclaimed books and has published numerous articles and is a forefront contributor to academic innovation and educational outreach. And the list goes on. Ma'am has presented various papers at national and international seminars. And we are really very delighted to have you here, ma'am, and also very privileged. And wholeheartedly, I would like to welcome ma'am to the session. Handing over the session to you, ma'am. Over to you. Thank you.
Yeah. Thank you. I'll just share the screen.
Sure, ma'am.
Is the screen visible?
Yes, ma'am. Can you please make it in the slideshow mode, ma'am?
Yeah. A very good evening to all. Chaturmukha Samarambham, Vagbhadacharya Madhyamam, Asmadacharya Paryantam, Vande Guru Paramparam, Ragadi Rogan, Satatanu Shaktana, Sheshakaya Prasadana Sheshan, Autsukya Moharatitan Jagana, Yupurva Vaidyaya Namosutasmai. So, again, invoking the blessings of all Acharyas, we are here together to discuss a very important aspect of our clinical practice, OA. When the organizers asked me to discuss about OA, what at the outset I was thinking was osteoarthritis, I think pathology, possible clinical presentation, the general understanding, everything in the contemporary view, you or rather as practicing physicians, we will be knowing at least to an extent. What I would like to communicate with you are some of the introspective understanding that I had observed through my limited clinical observations in my years of practice. And as a part of being in academy, certain kind of observations of how exactly we must plan a treatment protocol. And since I am a person of Panchakarma, my concentration more would be on, Kriya Kramas, how to select. Of course, I'll be touching on internal medication, but more on the Kriya Kramas that we can practice in OA at both OP as well as IP level. Okay, with this background, I am at the outset thankful for the organizers for the opportunity and happy to interact with you all. Yeah, so this is Ashtangam, our campus. So whenever you are into Palakkad, moving on, you're always welcome to the 18th Ayurveda Medical College of Kerala. Okay, fine. So I have actually divided my contents into 3 parts. Primarily osteoarthritis, I have primarily and commonest area that we all face. A point. So exactly, the mechanics of intervention. How can we intervene in a case when the patient comes to us? Second one would be the possibilities of various Kriya Krama, Ruksha, Snigdha, even Murtha Daila Prayoga. Is there a possibility for knee joint pain or, hip joint arthritis? And of course, in this practical application of external thailas are of a great significance. So we have n number of thailas in market. So we have to be having a clear idea on which thaila or which yogam to be used at what point. I think these 3 things I have tried to convey in my presentation. Okay, so I'll just invite your clinical, what do you call it as, acumen to a few cases that approach us in our OPD. Okay. So, you know, a 40-year-old female patient with severe knee pain, bilateral with swelling. She has come to us that she had visited a temple recently 1 week back, and she had to climb the temple over steps a lot. By the time she climbed up and down, she had severe pain. Now she is unable to walk and she is having swelling. She is approached us. Okay. So that is one case. So we will have to chart out a treatment possibility for this particular case towards the end with clarity. Okay. So could you please type, you know, in this case, what could be the internal medications that you would suggest? And, you know, what could be the external therapies that you would suggest at this point of time? Or, you know, if the patient says, I can admit, I will get admitted, correct me. If you could just share some of your thoughts in the chat box, it will be useful for us for a discussion later. Yeah. So I request all. Yeah. To please give your opinions with this background. Okay. In this case. So Punarnavadi Khwadam, Trayodashangugulu, Yogarajugulu, Arthavilvam Kashayam. Yeah. Snehana, Sthanika Dhara, CPS, Chandraprabhavati, Pindadailam, Januvasti. See how many opinions? Yeah. Punarnavadi Kashayam, Sajradi Kashayam, Kottam Jukadi Lepam, Dr. Surat says. Yeah. Thank you for your quick response. Kogilaksham Kashayam, Jadamayadi Lebam, Rasna Saptagam Kashayam, Punarnavadi Kashayam, Shadharanam tablet, Valu Kasvedam, Rasna Saptagam, PPS, Rasne Randadi, Punarnavadi Lebana Rukshana, Simhanada Gugulu, I feel, Ujjwal Sharma, right? Raktamokshanam, Jyoti, yeah. Kottanjukadi Lekam, Dr. Akshaya. Pavitra, Yogarajugulu, Trayodashangugulu, Rasne Randadi Kashayam. Yeah. Sajradi Kashayam, Lepam with the Jadamayadi, Janu Lepam with Marmani Vati, Pavitra. Dhanyamladhara, Agni Karmam, Dhara with Dhanyamlam, Vishnu Priya. Dr. Vikas speaks about Dashamula Ghanavati. Yeah. Okay. First Rukshana with Kottanjukadi, then Taila Prayoga with Kshirabala, then Rasna Panchakam. Okay. CPS, Dr. Gargi Kaustubh. Okay, fine. Okay, so thank you for your responses. So these, see, we are, you know, a lot coming up with so many opinions, okay, in a single case. So definitely we need to come with the most effective, rather cost effective, the best, shortest way to make the patient normalize. We will discuss it. Okay. So that was case 1. Okay. Now case 2. Now see a 60-year-old female with bilateral varus deformity. Both knees have, like, you know, had varus deformity, bent outside. She is unable to walk at all, and she is having these issues for almost 5 to 8 years started. Now it is severe, and the allopaths have suggested total knee replacement. Could you again, once again, I'm happy with the enthusiasm of the participants sharing their views. So could you again share some of the possible treatment that you would suggest in this particular case? 60-year-old female with varus deformity and who has been suggested with total knee replacement. They come to us, doctor, I don't want to go for surgery. Okay, you please help us with Ayurvedic treatment. What will be our response? Januvasti, Upanaha, Agnikarma, internal Snehana, Januvasti, Shashtika, Sarvanga Abhyanga, Pindasveda, Pichil, Januvasti, Snehanam first, Dr. Anjana, Mrudulab, Upanaham and Januvasti. Anshu Rathod speaks about Patrabindasvedam Snehana, Janudhara, Upanaham, Dhara, Brahmana, Lepana, Bandhana, internal Sneha, Anvasanavasti, Veshtanam Vishnupriya, Dr. Anjana again Upanaham, Januvasti Upanaham, Sneham Janavasti, if Niramavasta, Matravasti, Shirodhara for nerve stimulation, Shashti Vendasvedamai. Bhavani Reddy, Janavasti Pidchal, Rasna Saptagam, Rasne Randadi, Abhyanga BPS. Janavasti Gandhadailam intake Upanaham. Okay. Dr. Anjana ghee intake. Okay, fine. Okay then. So I think if we generally say Tikta Kshira Basti possibility have come up in this case comparatively, and I think Upanaham and Januvastis were told more in this case, right? Sahityapals also speak about Januvasti, Upanaha, internal Sneha, Matravasti, Panchatikta Kshiravasti. Asti Poshakavati. Okay. Nalini. Okay then. Thank you. Thank you for your responses. Okay, now we'll go to the third last case. Okay. Now a 20-year-old boy. Okay. He had actually fell down from a bike and he has acute knee joint pain with swelling. He just fell down from the bike. His knee got an injury and acute knee joint pain with swelling had approached you. It's just today morning it has happened. And today evening he has come to your clinic. Okay. So in this case, what would be your suggestions? Yeah. Once again, I request everyone to please. Yeah. Muruvanna bandage, marma adi guliga muruvanna, lepam with kartavatte with egg white, marma viluga, marma lepam, marma guliga, I mean to say, right? Mustadi marmagashayam, jaloga vajaranam, nagaradi lebam, Dr. Ramya Nair, Madhu speaks about Muruvanna Thailam, Dashmulak Shiradharam Sharanya, Nagaradi, KM Lebam, Muruvanna Thailopanaham, Kaishorugulu, Muruvanna Mustadi Marvam, Lebam Yogaraja, Yogokshura Manjista Punarnava Kwata Dhara, Marmalepam, Muruvanna application, Vadarekto Bakramam, Pindadailam, Mustadi, Knee bandage, Zanandra Gasham, Lakshadi Guru, Jadamayadi Lebam, Lebam Muruvanna application. Okay. Fine. So I think here generally Muruvanna has come up more. Kartavatta Marmavatta has come up more. Mustadi Marmakasham has come up. Nagaradi Lepam has come up. Lepam and bandage were said more over here, right? Nivedita speaks about cold Muruvanna. Okay, fine. Anything else? Muruvanna bandage, KM Lepam Jadamayadi. Yeah, fine. Ruksha to decrease Ama with Kola Kulatadi. Ayush. Then Taila Prayogam with Muruvanna. Okay. Fine. Okay then. Okay. So again, thank you for your responses. So with this background of responses and 3 cases, we will move ahead with our presentation. Okay, fine. See, when we are dealing a knee joint, a primary understanding of these things, I think I'm aware, but we'll just move away. I mean, we'll just brush up some things. Because when we speak about knee joint specifically, we have muscles, the quadriceps in the front, the hamstrings in the back, of course, bones, femur, tibia, and fibula, and we have the ligament, meniscus. Okay, anterior cruciate, posterior cruciate, medial collateral, lateral collateral, 4 ligaments, the medial meniscal, lateral meniscal, hamstrings muscles, quadriceps muscles. Okay. Now let us see if in the first case, okay, if we think of anatomical understanding, in the first case, when the 40-year-old lady might have walked a lot into steps through the temple and came down, what could have been the possible mechanism over here? The possible mechanism definitely would be, the knee was bending, straightening, bending, straightening. There was more strain in the muscular area. Okay. So naturally, quadriceps, hamstrings, stretches could have been more in that case, which might have resulted in the so-called swelling. But at the same time, that 60-year-old lady with already varus deformity, what could have, if we visualize the anatomical structure of knee joint of that lady, so what would have been the situation? All these joints would have been degenerated with not so smooth. All this ligament, it would have been wear and tear might have happened. It would have been very what you call it as thin or very rough in the background. The meniscus might have exclusively thinned out, and the muscles and all could have been more sparse, with less of strength, with more of gap, and there could have been, with respect to age, a little more of wasting in that case. Now, in the third case, when he had fallen with an injury and that swelling, the issue could have been most probably to a ligament or a meniscal, because there was a direct hit, and if at all something has to hit something and suddenly pain has to happen, it is this area that would have been affected. Okay. So this basic anatomical understanding we can have in mind in the background of knee joint. Okay. So as we all understand, when we think of knee joint, bones, femur, tibia, patella, lateral bone fibula is of course non-participating. The ligaments, medial and lateral collateral ligaments, anterior and posterior cruciate ligament, and definitely which actually shock absorbs our medial and lateral menisci. Because, all those structures of the body which have weight-bearing nature have complicated structures. Whether it is, our knee, hip or shoulder, which have more number of movements, more activities and more weight-bearing, they are more complicated in the background. Okay. So you could see actually knee joint ligaments over here, the anterior cruciate, the posterior cruciate, the medial collateral, the lateral collateral. And the medial meniscus, the lateral meniscus. So, when a thump thing happens, like somebody falls with knee folded, it is meniscal tear, that is most possibility. Somebody has an injury by, outstretched leg. Most probably it is collateral ligament injury that can happen. So this basic understanding we can have in our background. Okay. So you could see actually these many ligaments and menisci is basically for the activity of that knee joint, which actually bears our whole body's weight to be in the best possible way. You could see how lateral meniscus acts in between these two bones. Medial meniscus, the cruciate ligament, and the lateral ligaments, collateral ligaments that actually strengthens these by connecting and helps in the movement. Okay. So you could see the structure: posterior cruciate, anterior cruciate, lateral collateral ligament, medial collateral ligament, the lateral meniscus, and the medial meniscus. Okay. So let us have this as a basic understanding of a knee joint. Okay. So now, when we see the cases to us, most probable presentations of knee joint would be pain, especially in the medial side of the knee. Why? Because mostly when we think of osteoarthritis, it is most common type of osteoarthritis is medial compartment osteoarthritis only, which is seen as someone ages. So pain is especially on the medial aspect of the knee. And what happens is pain is there on climbing steps or walking to a long distance or on squatting. Pain may be with or without swelling, and sometimes most probably pain radiates down or towards the popliteal fossa. So these are the common presentations that a patient can have when it comes to knee joint pain. Now see, if we think about, a normal collateral ligament and an osteoarthritic joint, you could see this could be the possibility. The smooth joint space, this is hypertrophied things. All the structures are hypertrophied. We could see the borders being conjugate, very rough, etc. Okay. Now, very uncommon presentations on injury would be if there is an acute onset of pain after a shear strain on the knee, most probably it is a meniscal tear. Okay. And then, onset with feverishness, pain, tenderness, redness, local rise of temperature, possibility of a septic arthritis local. Acute onset pain with tenderness towards one side, either on the lateral or the medial. It could have been a ligamental injury, medial collateral ligament or a lateral collateral ligament. So this basic understanding we need to keep in our work. So, when a patient comes to us, it is very important that we record the presenting complaint in detail, history, onset which is acute or gradual, and beware, not all presentations in an elderly person may be degenerative. When I say this, it is very important that the first lady who was going to temple came back with the pain and swelling. Was she passing motion every day? Was her sleep good? If her passing of motion was not regular, she was constipatory, her apana vayu is already affected, and then she was not having a good sleep. Her pranavayu, there is vatakopa and pranavayu. In such a background, treating a knee joint pain. And another lady who has good bowel habits, her vayu, vid, mutra, pravartanam, everything is okay. She goes to climb up and come down with a knee joint pain. We have to understand that in Ayurvedic understanding, the first one will be more difficult to cure when compared to the second one, because ours is not compartmentalized understanding. It is this thing that I would like to communicate more, that how we'll be able to deal with these cases in practice. So definitely, once in step one, once we make up the whole history in detail, for us, some patients tell that pain, doctor, I have severe pain during midnight. 12 o'clock, 1 o'clock, I have this pain, I get up. Then by 3, 4, I just run, I sweat a lot, and then 5 o'clock only, I sleep. That indicates there is Pittanubandhatvam, because it is Pitta Kala in the midnight. So we have to understand there is Rakta Pitta Dushti in the background. Anubandhatvam is Rakta Pitta. You have to go for Manjishtadi Kashayam. You may have to go for Shatavari Chinnaruhadi with the Punarnavadi, not the Rasna Saptagam or Nasna Panchagam. In those cases who present with increased pain in the midnights, with this along with sweating. So this understanding we must have in our background. So step 2 would definitely, when we examine the knee joint, whether there is swelling, whether there is crepitus, any rise of temperature, and what is the range of movement. So as we all know, swelling, it is when Shobhavastha is there. It has to be Vata Kapha. Crepitus, definitely Vata plus plus. Somewhere there is Rukshata that is making this sound. So there is Vata plus plus in the background. Any rise in temperature, definitely Pittanubandhatvam. And when there is range of movements getting affected, we need to understand whether it is because of Stambhatva of Kapha or because of Vata Kopa. These two things we have to differentiate. So first would be history. Second would be, the examination point of view. Range of movements when it comes to knee, we'll be able to think of flexion and extension as the two movements. Now we could see how, an osteoarthritic knee, it has a change, the eroding cartilage in the background, the exposed bone, degenerated meniscus, hypertrophy of bone and sparring in the background. It is this scenario that has an osteoarthritic knee, because when we think of or when we discuss osteoarthritis, every joint issue over a period, like every avarana after 1 year becomes dhatukshaya. Similarly, any joint problem over a period will land up in osteoarthritis. Whether the patient was having psoriatic arthritis or an SLE or a seronegative arthritis or an RS spectrum, definitely will land up in osteoarthritis. Now, in a patellar tap test, that is that becomes positive, which indicates an internal effusion, can see there is Vata Kaphanubandhatvam in the background more. Or, the patellar tap test is not negative, but this external mild swelling, that Kabhanubandhatvam is not as severe as the patellar tap test effusion that we observe clinically. Now, when it comes to ligamental injury, we could see acute activity with severe pain concentrated on a one point, either on the middle or lateral. Definitely we have to make us move on with the injury part. Okay. So, when we are investigating the case, knee joint X-ray, gold standard for an OA. Knee joint MRI has to be done, which is gold standard for meniscal tear or other soft tissue injury. Because, grade 1, grade 2, grade 3 or partial complete tear and all. So that is one possibility. Okay. Yeah. Now, let us, with this background, basic investigation and basic anatomical understanding, I would like to put your attention on our tenets of understanding the whole Samprapti. So definitely when we think of knee joint, it is Kaphasthanam Vata Vriddhi. Chronic, there is Vata Anubandhatam. So primarily when we see a case, we have to have a clear-cut idea when it is a knee joint pain, whether the knee joint pain is a Swatantra Samprapti one or a Paratantra Samprapti one. Because as I understand, you think of, not only Janu Sandhi Shula, but whether it is Tabdata of Sandhi or Sabdata of, what do you call it as Uru or Sabdata of Pada, all this includes pathology of joints in the lower limb. It need not be exclusively Janu when we think. And my clinical observation is when Samana is involved, Grahani's Rupa has got Sandhi Shula in it. Gulma's Purva Rupa and Rupa has got Pada, Janga, Uru, Shula, etc. in the background. So we have to analyze whether the Samprapti that we are seeing in a patient is a Swatantra knee joint Samprapti or a Paratantra knee joint pain that is actually secondary to a Gulma Samprapti in the patient or a Grahani Samprapti in the patient. In that case, your medicine has to be Chirvilvadi Kashayam, your medicine has to be Gandharvahastadi Kashayam, your medicine has to be Dusparshakadi Kashayam, your medicine can be Indupaganam, Churdam, etc. Only then the knee joint pain will get corrected. I'm speaking about the internal medications when we plan. As I mentioned, it is very important that we analyze the Samprapti. Now, the patient, when he comes to us, primarily we do understand it is Vata, Kapha, Anubandhatvam or Pitta Anubandhatvam with respect to the symptoms of the patient. For us to analyze, it is very important that we have an idea about the extent of Dhatu's involvement in that case. We all know that Sandhi Shula, Parvajam, Parvana, Mirukka, etc. has been a part of Asti Dhatu's involvement as well as Majja Dhatu's involvement. So whenever there is Parvana Mirukka, whenever there is Sandhi Shula, whenever there is Sandhi Cheshta, Hani, Sashofatvam, etc., there is involvement of Asti Majja. But the fact remains that Asti Majja will never get involved without the affliction of Rasa Rakta axis. Now, when you see a female, when we examine, you just make the patient lie down. She may complain about knee joint. So you just examine the knee and just take your hand just above the knee to the medial part of the thigh. Okay, females especially, even males, but more in females. And you just press, the patient will cry like anything. There will be severe tenderness. Of course, it's because of the inflammation in the quadriceps and the hamstrings, especially in the hamstring muscle. But, in all those cases, their Rasa Rakta involvement is always severe. In that cases, unless and until you go for Amrutotram or Rasna Panchakam, which is Same Sandhyasti Majjage indicated, with some Amritarishtam Punarnavasvam initially, then followed by other sector of medication, only then we will be able to give the patient a long-term benefit basically. So, Paratantra Swatantrata of Samprapti has to be analyzed. The extent of involvement of Dhatu has to be understood. If the issue is chronic with Asti Majja Dhatu, we have to understand the issue is going to be Yapyam. But if it is not with Rasa Rakta involved, then in the background, not much chronic. If we correct the metabolism, the whole issue can be better. This understanding we need to have in mind. Hope I am clear. Okay. Now, as I mentioned, certain specific key questions would be swelling, as I mentioned, whether it is patellar tap effusion or external swelling. Patellar tap is positive or external swelling. How long or how much is the disease severity? And Anubandha Doshagoba, how clinically the patient presents with it. So when I say, when we are thinking of a knee joint exclusively, articular and non-articular structures. Articular structures that involve the synovium, cartilage, joint capsule. Non-articular structures like tendon, facial, etc., muscles, related nerves. So this basic understanding also we need to keep up in our mind. Many a times in cases of a kind of avascular necrosis cases, patient may present with knee joint pain initially. Only then when we don't know initial stages, we examine the patient and make them undergo Patrick test and all. Then we'll be identifying restriction in the what you call it as hip joint. Then if we investigate, we'll be able to understand maybe grade 1 AVN. But the patient might have initially started with the pain in the knee, because that restricted hip joint pain will not be identified by individuals easily, because we will not be examining it much as such. But initial presentation of knee joint issue only will be presented. So when we see Sandhigata Vata doesn't mean at any point that there is absence of kapha. Kapha Vatahara Aushadha in the acute and Vatahara Aushadha in the chronic state should be our line of management in the output. So output, when we assess, how can we conclusively speak, a few things would be chronic knee joint pain with marked swelling, patellar tap positive with no inflammatory sign. Chronic Vata Dushti at a Kabasthanam, Ruksha Guna Vriddhi where Snigdha is needed. Vata causes space expansion and secondary kapha visheshan, and in effusion, Shopham is seen. So there, Vata kapha dushti, Vata plus with Kabhanubandhatvam, Samavastha, Shopha. In the background, we always have to think about the Agni status and Apana. Unless and until the Apana Vayu and Agni of a patient is corrected fully, we will not be able to manage it. So always our prescription must have something that would, if it is not correct. Actually, ideal Agni Pravartanam and ideal Apana correction is actually Jirnahara Lakshana's presentation. That is Prasrishte Vindmutre. Morning, Hridi Suvimale. So morning getting up, and if he passes motion in the morning first time, that indicates his apana is good in thing. Otherwise, there is an issue. Even though once or twice he may pass after food, or even after food, there is some issue that has to be corrected. Unless and until that gets corrected, our other responses will not be good. That is why I think Kerala's tradition of practice always will have generally and Gandharvastadi Kashayam as a part and somewhere in the prescription if there is a problem at apana line. Okay. Now, now the issue was many of you told whether to go for Upanaham or whether to go for Lepanam. What exactly is the status of Upanaham or Lepanam? Now see, Upanaham is a kind of Sveda. Okay. So whenever there is localized issues, Upanaho Bandhanaha, it has been told. The 4 types of Sveda, Tapa, Ushma, Upanaha, and Parisheka, are 4 methods of bringing in Svedana in the body, which in turn actually brings in Shroto Shuddhi in the body. That is an indicator by using different mediums. So whenever there is Kapha plus, Tapa Sveda, Tapo Vasana Phala Hasta Taladibhi, dry Ruksha Sveda. Whenever there is Vata Kaphanubandhatvam, Ushma Sveda, either in the form of Pinda Svedas or Nadi Sveda. Whenever there is Pittanubandhatvam, in terms of Sparsha Sahishnutvam, you touch, the patient has pain, Pittanubandhatvam, touch has got Daham, increased temperature. No Pinda Svedam, no Tapas Svedam, either Haratvam of Pittahara Lepanas or Drava applications like Dhara, Dhanyamla, Kshiradhara, etc. When there is Vata more, Upanaha has to be the possibility. So generally, when there is swelling and Shopham, definitely the first line has to be a Lepanam. Upanaham is never a first line of treatment. So swelling can be reduced with Lepanam. And then, as I mentioned, the patellar tap, chronic swelling, if then it persists for a longer time, then the possibility could have been the Upanaha Sveda. That is, you add with the according to Doshanubandhatvam, Kotanjukadi, if it is Kapha plus, Grihadumadi, which is Kapha, not as Tikshna as Kotanjukadi, Jadamayadi, which is Kalkam of Balaguluchiyadi Tailam, it is Pittaharam, Pittaraktanubandhatvam. Nagaradi, which is actually told with acute inflammatory condition. Guduchi Patradi, again Vadarakta, Rakta Pittanubandhatvam more. So all these things can be either used for Lepam. After the initial Shophaharatvam, only Upanaham is the preferred choice at that state. And Upanaham, we have to add the Churnam, any Amla Dravya, and oil, and a little Saindhava, so that the whole things brings in the expected results in the particular patient. Hope I am clear. where to apply lepa. And even, when we apply lepa, clinically, we have to be clear on 2-3 points. How much thick the lepas has to be. You all know pralepam, pradeham, alepam, etc. are the methods of lepa, depending upon, the doshanubandhatvam. So if at all, the third boy case who had come with an acute swelling, you can apply lepam. As somebody mentioned, marmavatta, kartavatta is a good choice because all acute injuries, there is a possibility. If there is such a temperature when you examine, Jadamayadi is a choice. Nagaradi lepam with karikinde tondinde neera, that coconut, what you call it as outer coverings, a liquid that has been told as its mixture, which is the which will be helping in the acute reduction of the inflammation. But whenever there is pittanubandhatam, the labum should not be thick at all. The labum has to be very light in its external application, and it should not be applied for a long time. How long should a labum be applied? Labum should be applied only till it gets dried. So that is why in Kerala, there is a practice of tore lepam. Tore lepam means lepam that is used again and again. Basically, you apply lepam in the acute low back ache, kartavattu, marmapattu, tore lepam is there. You apply lepam, then once it gets dried off, next lepam. Once it gets dried off, next lepam. Like 3 or 4 times lepam is applied. So lepam in the initial stage, Upanaham only in the later stage. Okay. So the Lepa Churna, as I mentioned, Kottam Jukadi, Kapha Pavata, Jadamayadi Pittanubandham, Grahadumadi, not as Tikshna as Kottam Jukadi, Vata Kafam, Nagaradi or Manikundirigadi in the background of Abhigadaja Vikara. So in the third case, the boy, we would never prefer Kottam Jukadi. Okay. The first lady case, if we would assess it to be Vata Kapha, Kottam Jukadi could have been a possibility. In the second lady case with a varus deformity, which is chronic with all Vata plus, no much role of Churnas at that stage is not there. Definitely, as many of you mentioned, we must think of a Snigdha Prayoga. But when we are thinking of Snigdha Prayoga, should we be going for a Janu Dhara or a Janu bandage or a Janu Vasti or, kind of Janu Piju, that we have to bring in a clarity in the clinical condition. Okay. So, whenever there is Amavastha, Amrutotram spectrum of medication, then, you can move on to Rasna, Saptagam, Jango, Urutrakaprishta, Shuli with the Nagara Churna Mishram, Rasna, Panchakam, Same, Sandhyasti Majjage. But if Pittanubandhatvam, Balaguluchadi spectrum, if Agni is proper and sufficient Amapachana has happened, Gugulu Tiktagam Kashayam, which is actually a modification from the Gugulu Tiktaga Grada mentioned in Vatavyadi Chikitsa, can be preferred. Of course, later stages, basically see, Rasne Randadi is never a choice in the initial stage because Sarpis Taila Vimishridam Prashamed Vayum Sa Shulam Tadha. It has been told. Vayum Sa Shofam Tada. So, what is that? Sarpis Taila Vimishridam. So Rasne Randadi has been told to be added with Sarpis and Thailam. So it is never a medicine that is given in the initial stage. After initially in our prescription, start with Amrutotram, go for Rasna Panchakam, Rasna Saptagam. Pain, heaviness comes down. Then Rasne Randadi, you can add with either a Sajradi Thailam or any of the Gugulu Tiktaka Grada, etc. When Sneha is added, then that can be a given choice that helps in the repair of the whole mechanism or maintenance of the pain, that would be same. And then later, again with chronic deformity cases, Maharasnadi Kashayam, with again Gugulu Tiktaga Gridam can be a possibility. Zeotone, there are so spectrum of medication with this understanding, can be a maintenance drug. So as I mentioned, Rukshanam with Lepanam or Upanahanam has to be stages when, Kapha plus Vata Anubandhatvam. Okay, that means Vata with Kapha more. But Snehanam has to be a process only when Vata plus Kapha. There, how should we decide accordingly? We will come to the point. Okay. So throughout, whenever in the second case that we had told that knee joint replacement lady, maintenance of Abhyantara Sneham is important. Maintaining daily abhyangam in the first lady internal medication, she make with come down with her pain, you know, go for Rasna Panchakam with Kaisharo Gulu Punarnavasam, then go for Rasne Randadi with Punarnavadi, and then she may come down with the medication, but she has to be observed, I mean, advised to practice daily abhyangam and manage in between relapses by Upanaham or Lepanam, as we understand, and non-pharma advices we need to work out. Now, when we think about the thailas again, starting with Kotamjukadi Thailam Muruvanna, to Dhanvandran Thailam, to Kedagi Muladi Thailam, which is specifically for Asti Majjagada, that has to be our order. I'll just share with you one of my clinical experiences with, you know, how simple things can make issues worsen. There was a lady who used to come to me regularly in my OPD. So she had called me with knee joint pain. She had called to the hospital. Doctor, like I'm unable to visit you. I have knee joint pain for last 2 days. I was traveling. I had come to home. So now I have pain, doctor. She's 65 plus lady. Okay, so Nyan Barnu, how are you? Then you are able to walk? No, I have swelling, I have pain and all. 2 days I had long period of walking. So I had just that. I have pain now, unable to stand. So what I told her, you, so na the Thailam, you have Sahajaradi, Muruvanna. She told Illa doctor, I have the Dhanvandran Thailam with me. So I told a 65-year-old, she walked a lot. She will have pain. So I asked her, you apply Dhanvandra Thailam and just be there. Okay, and apply that one. And you wash it off. Let us see if anything happens, get back to me. Now, you know, after 3 weeks, she had come to me and she told me, Doctor Anna, after applying the Dhanvandra Thailam and all, by evening pain had increased to such an extent that I had to go to the allopathic doctor to reduce my pain. So that is why I couldn't visit you. Now I had come. So she was visiting me for long period. Okay. So I had asked her, so I think that was post-COVID, like 23, 24 time. I mean, 22, 23 year. So she had told me, you told me Dhanvandra Thailam. So I told, yes, Dhanvandra Thailam, etra neram. Ad apply cheyidata you had applied and washed it off. She told, no, doctor, I had applied it. After some time, I thought, once again, if I apply, it will be much better. So after half an hour, I again applied it. Okay. And I stood in the kitchen. So I told, after that, you didn't wash it off. No, I did not wash it off. I was in the kitchen. So I just thought applying oil, I will do work. So it will be in my legs for longer period. So in between, I had applied 2 to 3 times Dhanvandra Thailam. And then I had applied and I was standing in kitchen, did all my work, cooking work, etc. She called me by 10:30. And by afternoon, I had more pain as such. But then I did everything. I thought pain will aggravate. By evening, so you did not wash away the Thailam. No, I thought let the Thailam be there. And then, you know, if the Thailam be there for a longer period, my pain will reduce. But by the time 3 o'clock, 4 o'clock, my leg, calf muscles, everything got swollen like anything that there was lot of weight. And finally, my husband took me to hospital. Now, see, if she would have applied the Dhanvandra Thailam maybe for 15 to 20 minutes and washed it off, this much issue might not have come. Okay. So what has happened, Dhanvandra Thailam? That too, which is more Brahmana, it just got Kshiram and all as a part of it, which is actually mentioned only in the Nirama Avastha. And she had applied it again and again. And after applying it, she was near the stove for all cooking, standing up. All this might have increased the Pitta Kapha Utkleshana. And we were applying a continuously Brahmana Thaila in the background. And that too, she did not apply any Ushnodaga, nothing. And that over a period. So, you know, when we are suggesting even Abhyangam, how long an Abhyangam has to be done? How long the oil should be retained in that area, whether it is knee or somewhere. It has to be 15 or 30 minutes or 1 hour. Depends upon the sampraptaya of the patient. And the second thing there over is the kalam. If it is Shita Kalam, you can keep for a longer period. If it is Brahmana Thailam and the patient is Vata plus. If it is Varsha Kalam like Kleda, long period will again cause Ama. This will not be the same case of using some other Thaila kind of Kotanjukadi Thailam in Ushna Kalam. So in practice, Kalam and Samprapti, Avastha, These two are the factors that determine how long the oil has to be retained in the body. And this actually differ from place to place. I don't think the same background can be practiced if you are from Sikkim, which has got a different climatic condition. If you're from Rajasthan, which is more dry. If you're from Uttarakhand, which is again, very snowy area. This you yourself have to find out which is the best possible and time period. But in mind, we must keep that two variables, time, how long the oil has to be applied, and according to the column, how can we change the oil period. This we have to keep always in mind. Okay. Now, additional thing we really need to understand, if there is a knee joint degeneration, what is the background? She was having this issue long period back, or she was having some other issue. At 40s, is she having severe premature degeneration? What actually is the lifestyle of the patient? Vitamin D deficiency is definitely one of the initial phases of, which triggers osteoporosis. And there are possibility in, yeah, what do you call it, as elderly individuals landing up in conditions like multiple myeloma, which even I have seen. More Ayurveda doctors had continued to understand it to be, knee joint pain, osteo, Sandhigadavadam. But under any circumstance, pain was not reducing. They had done Shashtigam, everything, no pain was reducing. And further on investigation, it landed up to be a multiple myeloma case. So that, I understand. See, in Shamana Chikitsa, Shutta Trit Vyayam Atapa Marute has been told, Pajane, Dibane, Pajane, Shuttrit Vyayam Atapa Marute are the 7 methods of Shamana. And for us in our, our treatment modality itself, Vyayamam and Atapam are 2 Shamana treatment methodologies. So for Shodhana, whether it is Chaturveda Samshuddhi or Kaya Shiroreko Asravisruddhi, the 5 Pancha Shodhana, Shamana, when it is Pajana, Deepana, Shuttrit, Vyayam, Atapa, Marutam, all initial stage of Dosha Dushti, when there is, from Chaya to Kopa before Sthana Samstraya or in the initial stage of Sthana Samstraya, Vyayam and Atapa has to be a part of our treatment. So whenever, I ask our patients to have medication, and every day evening, you just go to some ground or paramba, you have some place, open space, try to walk in that, and in a way that your body gets exposed to wind and atapa. These 2 things are relevant in the background. Of course, non-pharma advices like weight reduction, kneecap wearing, daily abhyangam bandage, considering quadriceps, hamstrings, and calf muscles while doing daily abhyangam is a very important thing. Calf muscles, pindikodveshtanam is always seen. Pindikodveshtanam is a lakshanam of Shakrit Graham, basically. And, whenever there is Apanavayu issue, you will be having more of Pindikodveshtanam. So whenever, if we are doing planning abhyangam, even at home to our people or ourselves or our patients, if you are just asking them to do abhyangam, make sure 4 parts. Of course, Shirashravana Padeshu, Tam Visheshana Shiled we do. But Pada, this because it has got special affinity towards your Urdhva Jatrugida Vikaras. It gives support to the Indriyas. Today only in our, when I was interacting with my therapist, the therapist told that, madam, 2 patients told us, when we were doing foot massage, she was having some light-like things in the brain. How this happens? She was inquisitively asking me about that case. Okay, so because when you see the gunas of Padabhyanga in Charaka Samhita, Sirasnayugata conditions, it has been told. We could see Pakshaghata, Sirasnayu Vishoshacha, Snayugata Vikara, all has got Padabhyanga to be a part of it. And definitely we could see that as Chakrapani, there is a nadi that connects the pada to the shiras. So Padabhyanga has got a role. Along with that, calf muscle, special muscle, calf muscle concentrating on that, hamstrings and quadriceps. You press females knee area just above thigh area, it will be very tender. So applying that things in that areas would be a very good thing for preventing any kind of degeneration in any part of the body. Okay. Now, coming from this background, basic background to specific Kriya Krama at the OP level and IP level. As we all know, IC is only what the mind discusses. So the Vikara Prakriti, That means, as I mentioned, all the symptomology of the patient. The patient may present with knee joint, but we have to assess whether he is having mouth ulcers, whether he sweats a lot, whether he gets very tired on having appetite, whether his sleep is in. So that Vikara Prakriti, whole clinical entity has to be kept in mind. The Adhisthana may be knee joints, but what else? Samuthana Vishesham. Samuthana Vishesham is actually the specific cause that would trigger. That lady might have, of course, walking background, but already she might be having some other things in the background which we have to assess, which help us in actually maintaining the treatment. So when we think of, different areas of issues, like, any sandhi, when we think of Ayurvedic approach, predominance of Vata in Kapha is there. Localization of Vata at an Upadhatu is a Sira Snayu Gada presentation will be there, causing pain as well as restriction. So whenever there is restriction, Kabhanubandhatvam, inflammatory response, Pittanubandhatvam, pain is definitely Vata plus. So when it comes to the neck pain, we have to think of Avalambaka Kapha, Tarpaka Kapha, Pranavayu, Udanavayu, Asti Mamsadhatu forming bones, muscles, ligaments, etc. And Shiras is a Kaphasthanam. So whenever we are dealing Kaphasthana, Urdhva Jatruvikaras or areas or pain, etc. in the degenerative issues in the neck area, our treatment must be more of Rukshana in nature. So unless and until, the person is Vata plus, age 70 plus, all this Vata. Otherwise, whether he is 40, 50, even at 60, if the patient we are approaching from the knee joint to a neck pain, degeneration of this thing, we have to think of a Rukshana in the background. In that spectrum, Dashamula Kadutrayam Kashayam, which has got Trika Prishta Katigraham, it has been told. So where it has special affinity towards Trika Murtha Ruja, Trika Ruja and Murtha Ruja. Dashamula Kadutrayam Kashayam is a very good Ama Pachana in pain pertaining to your Urdhva Jatravikara. Dashamula Kadutrayam is not just for our respiratory issues, but even for our so Dashmula Kadutrayam added with a Vettumaran Guliga reduces your neck pain, whether if it is Shiro Gauravam, background of sinusitis, there was rain, etc. So that spectrum has got results over there. Now, when we speak about low back, again, we have to be thinking about Pakvashya Gadavadam, which has got Shulanaha, Andragujanam, Vadma, Ashma, Trigaprishta, Katigraham. So Arshasa, Vadma, that hernia spectrum, along with Trigaprishta Katigraham, is a part of Pakvashya Gadavada. So naturally, Pakvashya Gadavada is the pathology that may lead to a low backache later as gridrasi or a knee joint pain. So correcting Pakvashya Gadavada is very important, wherein, there are two methods to correct Pakvashya Gadavada. One is Snigdha Virechana, second one is Vasti. So whenever, there is a Pakvashya Gadavada Lakshanas like Shula, Anaha, Antrakujanam, you must make him undergo, even though he may not have a Trigaprishta Katigraham now. If he now today is having Shula, Anaha, or Antrakujanam, he may develop a disc prolapse later within 1 year or 2 years. There is all chances of that. Otherwise, he may develop a renal stone. Or he may develop an inguinal hernia. In that stage of Shula, Anaha, Antrakujanam itself, when the patient may tell or you have to inquire, yes, only when we inquire, they may be telling. We have to make them undergo Snigdha Virechana, which commonly is practiced in the form of different erandas in Kerala, like Nirgundi erandam, Gandharva erandam, mixed with even Nirgundi Swarasam. Need not go for Gandharva Stadi or Gandharva Stadi Kashayam with the Gandharva erandam or Nirgundi Swarasam with Nirgundi erandam. Or Kadika Kashayam with the Eranda Thailam. Kadika is Haritagi. Haritagi Kashayam is made and Eranda Thailam is used. So, all these spectrum of people who have Pakvashya Gadavada Lakshanas like Shula, Ana, Hantra, Gujana as the initial, which may later lead to Arsha, Ardhma, Vardhma, Triga, Prishta, Ashma, Arsha, Vadhma, Triga, Prishta, Katigraham later. So, there is all possibilities. So, they have to undergo Snigdha Virechana or once in a while, Basti, either admitted or, at OP level. Madhu Thailikam and all can be done at OP level only. So as I mentioned, our unique approach has to be understanding the Adhishthanam, if upper limb Kapha, if lower, below Nabhi, Vata. So if upper issues are there, our protocol has to be Rukshana. And after a Koshta Shodhana, we must go for a Nasyam. If it is below Nabhija Vikaram, Snigdha Virejana followed by Vasti, or these two must be there in our treatment modalities. Yeah. Now, you know how Vata is assessed, like how chronically Vata or how much Vata is affected, how can we assess? Intensity of pain, range of movement, chronicity of complaint, and the Sama Niramavastha has to be differentiated. Pittanubandhatvam of any joint, you know, degenerative disease which may lead to an osteoarthritis later, whether whatever, most commonly affecting is knee and hip. You know, even you palpate the scalp of the patient. Okay. You palpate, there will be tenderness. You do simply do see the murdha, touch the murdha and feel the heat in the body. There will be burning sensation of the eyes. There will be loss of sleep, especially in the Pitta Kala. Generalized signs of Pitta Vriddhi like burning sensation, Atisveda. You have some hot food, they will be developing some ulcers in the mouth. So these things all will be in the background of Pittanubandhato. In such cases, you must do Virechana not with Eranda Thailam. You must do Virechana or Anulomana with Trivirth Lehyam or Trivirth Draksha Kashayam, and you must make him undergo Kshiravasti. So, only then, you know, this spectrum of people can be managed. So, I think broadly, when we see any spectrum of people who are approaching us, two broad things, Vata Kapha, Pittanubandhatva. So Vata Kapha is Amrutottaram, Rasna Panchakam, Rasna Saptagam, followed by Rasne Randadi Punarnamadi. Internal, it is like, you know, Ruksha therapies, followed by Snigdha Virechanam. But here, you know, it is like Pajanamritam Kashayam. So if it is Dashmula Kadutrayam with the Vitumaran here, it is Pajanamritam with the Sudarshanam. Which is followed by Manjishtadi, Shatavari Chinaruhadi in the background. Then, you know, the so-called Trivirth Lehyam, Trivirth Draksha Kashayam, Kshiravasti spectrum in the second spectrum of people. The patient may present with knee joint pain only. Okay. But we have to assess these two things to deviate the mode of management. Okay. Now, Kapha's assessment is stiffness of neck in connection with chronicity, heaviness of head, sides of neck, hand, pan sinus, tenderness will be there in more Kaphanubandhatvam. And diffuse spreading down pain along with discomfort and, you know, hands accompanying tenderness at the elbow, wrist. The whole upper limb will be of, you know, more of pain, tenderness in that area whenever there is Kaphanubandhatvam. So what I'm telling is, even though the patient may present with an ankle joint or a knee joint, our assessment is whole body assessment. Only after this whole body assessment, we will be able to have a clear-cut idea about what actually is the status of the patient. Okay. So many a times, Kabhanubandhato, or, you know, the patient may present with low backache or knee joint pain. It will be accompanying with the sinusitis. Frontal maxillary tenderness will be there. Shiro Gauravam will be there. Kapha Vilayana may happen due to Pitta Sanchaya because, you know, when they are exposed to some kind of wind or some kind of heat and all, they'll be having continuous sneezing. This spectrum, these people will be presenting. So superimposing myofasciitis kind of thing, you know, Pitta Vriddhi, Kapha Vilayanam, diffuse pain and heaviness in the neck. Vata Vriddhi, Kapha Gratitam will be there. There, you know, when Kapha is more Gratita, localized pain will and swelling will be there at elbow and wrist. So this we have to be always be careful. Kapha Vilayanam and diffuse pain. Such people will tell doctor, Ravale, morning I have neck pain. Then by evening that elbows like that. That pattern of myofascial fasciitis will come there. Gratita Kapha more means they will be having pain in the neck, localized elbow, which will be more early in the morning. By afternoon, it will be okay. By evening, again, they will be having the more issue. So Kapha's presence or Kapha Kala, Shita Kala, it will be more. So these two differentiation we need to make up. Now, you know, the whole osteoarthritis precursor, Vadaraktam spectrum. It can be an RA, Sjogren's, SLE, ankylosing spondylitis, psoriatic arthritis, gouty arthritis. Whatever, all these things over a period will lead to osteoarthritis, and it is important. And I think, you know, gouty, you know, pittanubandhatam, psoriatic, vata kabha anubandhatam, ankylosing spondylitis, gambhira vadaraktam, starting with pitta kabha vada, then vata plus plus, SLE starting with kapha pitta or pitta kapha. So this will be the clinical presentation. We'll not go into the details, but finally they'll land up at the so-called osteospectrum. And you know, when we are seeking about Vata-Rakta spectrum, similarly, there is Amavata spectrum with myofasciitis, gout, autoimmune spectrum of clinical condition. Now, what is the difference between Amavata or Vata-Rakta? Clinically, when we say Charaka, Susruta, Sangraha, Hridaya, don't speak about Amavata. They have spoken about Vata-Rakta, but with its Amavasta. But when it comes to Madhavakara, he had mentioned a separate clinical entity with Amavata, probably by the 13th, 14th century. Such clinical presentation were more in the society basically. So naturally, Amavatam, in the Samprapti, Kapha's involvement is more with respect to Nidanam and clinical presentation, Abhishandi Aharam. There in Vadarakta, Vidahi Annam Viruddhaharam is more. So Nidanam actually makes the clinically, specificity in the clinical presentation. Okay. In all these things, Madhyama Roga Marga is involved. Whenever Madhyama Roga Marga is involved, we have to understand the situation is Yapa in nature. So as I mentioned, primarily we have to understand if the disease is Swatantra with Dosha Dusha Samurshana or Paratantra in the background of a Grahani, Arshas, Gulma or Kushta that has landed upon the joint tissues. So in our understanding, these two things, you may not, you simply ask them, were you having piles? Yeah, I have that for a long time, doctor. So, you know, the external pile mass is only a manifestation of a big Abhyantara Vikara. Okay, that may land up from your depressive phase to your emotional issue, to your abdominal digestive issue, to joint pain, to all these things this Arsha Sudavarta spectrum has. Similarly, Gulma. Okay, fine. So, inflammatory initial stage may begin with Pitta Kapham. When it comes to little more, it may become Kapha Vatam. And when it becomes fibrosed over a period, it becomes Vatam. Okay. So with this background, now as I mentioned, towards the end, we will be discussing the different Kriya Kramas that can be planned in this particular cases. So let us plan. So with the internal medication spectrum, the first case, second case, third case, you may think what are all the possibilities that we had discussed now. Okay. So now, you know, in the second case, the second spectrum, the different Kriya Kramas, when we are thinking about the Kriya Kramas, possible external procedures or Kriya Krama in terms of Panchakarma, our variables are which one, how the procedure has to be performed, when it has to be performed, like morning, afternoon, or evening, how long it has to be performed. So these are the things that are very specifically, that have to be specifically addressed. Charaka very specifically says, Samyak Prayoga Nimitta Hi. Only Samyak Prayoga we have to be doing. So for that, we always say there is a spectrum of heat from Ruksha to Ruksha Snigdha to Snigdha. So I'm not going to detail about the whole thing. A simple a simple chronology of the things would give us an idea. Like, you know, all these Pindas Vedas comes under the spectrum of Ushma, which is generally Vata Kapha. When it is Ruksha, Kapha Anubandha Vata, Ruksha Snigdha, Kapha Vata, Snigdha Vata. That's it. Okay. So from Ruksha Sveda to Churna Sveda to Patra Potla Sveda to Dhanya Kidi to Utkarika Payasa kind of Shastika Pinda Sveda, it's a traverse from Ruksha plus plus to Vata plus plus. Okay. So whenever, you know, when you're doing a Pinda Svedam practically in clinics, you do this way, it is the speed of the kidi, totally. The pressure, you do it this way, the pressure, temperature. These three things have to be very specifically understood. It is, when the speed is more, speed has to be more in Vata, less in Kapha. Pitta, no speed at all. Pitta, we don't do Pinda Sveda. I mean, no Potli Sveda is done. Temperature at the same time has to be manipulated. Kapha and Vata, both high temperature, but Vata has to be higher temperature, Kapha not much higher, because temperature, if it is very high in Kapha, Vilayanam will happen. So it has to be a little Ushnatam only, not much Ushnatam. Pitta, no temperature at all. Pressure has to be more in Kapha when compared to Vata. Unmardanam has been told in Kapha's Chikitsa. Only Mardana has been told in Vata's Chikitsa. So these things we have to keep in mind. So, you know, the various Pindasvedam told in Charaka, Tilamasha Kulatta, Grida Dayala Amishodane, Paise Krishare, Gokara Ushtra Varaha Shagridbi, the different Ruksha and Snigdha materials that has been told. As I mentioned, Upanaha is Vatahara, Tapasveda is Kafahara, Ushmasveda is Kafavata, Dravasveda is Pitta Samsrishtavata. And if at all you have a Medo Dhatu's involvement more in the Samprapti, definitely you have to go for Anagneya Sveda. Because of the special presence of Kapha over there, if you go for Agneya Sveda, Kapha Vilayanam will happen. That will again cause much problem in that issue because Kapha and Medas have got Ashraya Shray Bandham. That is why Kushta, Prameha, etc. is exclusively contraindicated for Sveda Prayoga. If at all we need to bring in Sroto Nairmalyam with the Svedana, we have to go for Anagneya Sveda only. So this understanding we must be keeping in mind. Along with the Rogas, Bala, Roga and Rogis, Bala is important. Whether we have to go for Mahasveda, Madhyama or the Sveda. Okay. Durbala Sveda. I mean, how long, how much it has to be given. Now, the second aspect is Pitta Samsrishtavada or Pittanubandhavada, Dhanyamla Dhara. Dhanyamlam is a very good choice. Dhanyamlam Dashamulam Kashadhara. I think Dhanyamlam can be made by everyone if they have your own clinic. This is the way we make continuous 6 to 7 hours, 70 liters of water with all the medications. Shashtika, Tina. This reference is from Sahasra Yogam. Okay. This making of Dhanyamlam. Actually, in the text, Charaka Sushruta Hridaya, the Dhanyamlam is fermented Amla Kanjikam, which has to be made from different dhanyas. The Dhanyamlam that we are talking here is the yogam that is mentioned in Sahasra Yogam, a Kerala's innovation that has been told at different places in Chikitsa, Manjari, etc. Wherein Tina, Laja, Ajamoda, Shunti, etc. is added. Shashtika, Prutuka, Kulatta, Jambira is added like Dola Yantra. Water is taken, it is boiled. And after 7 days of boiling continuously, whatever liquid we take, we again fill it with hot water. Okay. One set of medicine is practically used in our center for 1 month. After that, they change the whole thing. So this is the way the different materials are put up. Okay. So Dravasveda, Kashayadhara, Dashamulam Kashayadhara, Asanadi Kashayadhara can be done. Okay. Now coming to next set of treatment, like, you know, when it comes to Janu or any Kati or whatever, where to do Janu Dhara, where to do Janu Vasti, where to do Janu Abhyangam or Janu Piju or Lepam. As I mentioned, Shofaharam initial status Lepam. Next, where to do these things actually are based upon the same principles as Murdha Taila. Because Murdha Taila Abhyanga Sega Pijavo Vastishtihati Chadurvidam. Tatra Abhyanga Prayoktavyo Rausha Gandu Maladishu. Arumshiga Shirastoda Daha Bhaga Vraneshutu. So that has been told. Arumshiga Shirastoda Daha Bhaga Vraneshutu Shirodhara. So Arumshiga Shirastoda Daha Bhaga Vraneshu means actually all Pittanubandhatam. So whenever there is Pittanubandhatam in your knee joint with inflammatory response, Janu Dhara is the choice. When it is Vata plus, okay, Prasupti Arthita Jagare Nasa Ase Shoshe Timire Darunecha Shiroroge Vastistu. So Shiro Vasti. Same is the principle for Janu Vasti or Kati Vasti, Vata plus. So definitely, as many of you mentioned in the second case, wherein there is virus with all plus of Vata, Astikshaya, all those things, there our treatment modality in the later stage would have been the Janu Vasti treatment only. Okay. Of course, direct Januvasti, you may not be able to go. You have to see if there is effusion and all, then you have to go for Upanaham. Start with Dhara if there is Pittanubandhatam, 2 to 3 days of Janu Dhara, then go for Januvasti. Now, Janu Pichu is similar, you know, somewhere between Janu Dhara and Januvasti. You know, what is there? Netrasputana Stambana. Okay, so Netrasputana Stambana. So it is more of Kapha Vata Haram, I mean, Vata Kapha Haram. So from more, you know, from Pittanubandhatvam to Kapha Pitta Vata in terms of Piju, and then Vata plus in terms of Januvasti. So somewhere in between you can go for. So somewhere practically we actually, after making the patient undergo a Januvasti, in the evening we do a Janu Piju, okay, with oil, and then we keep it like that. Janu Piju and Janu Bandhana are almost similar, but in Piju, more thicker cotton with oil is kept. Bandhana need not be that way, but some almost similar. Okay. Janu Dabhyangam is the initial thing which everyone can follow as a part of daily thing. I mean daily dinacharya. Okay. So as I mentioned, for lepam, Kattanjukadi Kafavatam, Jatamayadi Pittam, Grahadumadi Vatakafam, Nagaradi or Manikundragadi Abhigatajam. Lepam in clinics, as I mentioned, the variables we have to understand is thickness of lepam, the temperature of lepam, and frequency of lepam. Okay. So again, in Sthanika Kriya Kramas like Dhara Piju Vasti, we must have an understanding of which one to be specific, how long, how to do, and when to do. Okay. Dhara again, as you need not again directly go for a Taila Dhara. In the second case, the injury case, third, the boy had come. You can go for lepam, but immediately for reduction of the pain and all, you can go for a Jadamayadi. What I practically do is, Jadamayadi is boiled in Kanjikam, and then Dhara is done for initial inflammatory responses. Okay, all this CTS, acute tenderness, or some, this only ankle joint tenderness, we go for Jadamayadi, boiled in Dhanyamlam, do the lepam. So that one can be done. After 2 days, we may go for Dashamulam Karaskara root boiled in Kshira, which is Sadhyoshula Nivaranam. Then, only then we will go for like Dhanyamlam, Dashamulam Karaskaram, Kshiram. Only then we'll go for Taila Dhara as stage wise. Okay. Pichu, the same thing. Okay, so how long to do? Generally, all these things, Pichu, Vasti. Pichu we keep for 3 to 4 hours. Januvasti we do generally for 1 muhurta, 45 to 50 minutes. So that you can variable, how long. If the patient says ki after 30 minutes, I have heaviness in the knee joint, you should not continue Vasti, Januvasti. You have to stop it. That is the stop. Even after 1 hour, the patient has got no specific change in the crepitus after 2 or 3 days, then again you can continue the period. So maximum up to 1.5 hours, you can continue Januvasti. Okay. Some minimum 30 to 1.5 hours, you can continue. And then, systemic manipulations like role of Snehapanam. There is no doubt that Asti Majjagada, the best thing is internal Snehana. So after the Samapachana, Kashaya and all, he must be made to undergo Snehapanam for a longer period of time. And if you're admitting the patient, when should we admit the patient? If with your internal oral medications, Shamana Ushadis, if the patient is not getting result, then you must say you have to get admitted. There is no doubt about that. In that case, in all this degenerative spectrum, the first choice would be definitely Vasti. If Samavastha there, you may think of Ardhamatrika Vasti. Vaidharnavasti and all can be thought as an initial stage in young patients. Otherwise, Ardhamatrika Vasti. And generally, the best thing in these people are Tikta Shiravastis, which has to be done not initially, after a period of time. Okay, towards the end. Snehapanam, the best choice would be Brahmana Snehapanam or Shamana Snehapanam. Brahmana Snehapanam along with food as Vicharana. Shamana is, when the patient is having appetite, then you continue a dose and continue till the Vyadhi Shamagatum is there. This we usually practice in severe knee joint pain after Shodhana and all. 30 ml and all continued for almost 10 days. During appetite, we give 20-25 we start. When they get Hrispa Matra, then when they get appetite, Kanyi only that. Second day, same, almost same doses maintained for a period of time till that knee joint pain is reduced. Yeah, Vasti, Ardhamatrika Vasti with Dashmula Kashaya Madana, Shiravasti, Yapanasti. Now, when we move to the tear spectrum, meniscal tear, ligamental tear, I don't have much clinical experiences in dealing with acute ones. But with my limited clinical experience, we have a Marma OP, we send it to that. With my limited, if it is grade 1-2 tear, we'll be able to manage it. Initially with the rest, Lepanam, internal medication. I have cases wherein, they had long last previous ligamental tear, 4 or 5 years back. Now when they run a lot, then they have a pain and all. In that spectrum, we are doing other processes. Okay. So quickly going through the different Pindasvedas. The Ruksha Pindasveda include Valuka, Kulatta, Vasa, Sankara, Avikiri. 250 grams of churnam for a kiri. And in Sankara Sveda or Mukhi Kiri in Malayalam we call, liquid is taken and bolus is kept and it is heated in liquid and it is applied in the initial Samavastha. Especially whether it is knee joint, hip joint involved, Ardhangam below Nabi is done. If in older patient, if the whole body procedure is not done, if concentrated to the knee and hip, only that is done. Avikiri or Ushma Potlas Veda is boiling the Dhanyamlam or Dashmulam Kashayam and the thing is covered and then, the potli is heated over there. Avikiri or Ushma Potlas Veda is more Kafaharatvam than Mukikiri. Okay, because Ushma is becoming more Sukshma. So in those Samavastha, we do Mukikiri or Sankara Svedam and the patient does not respond with pain or stiffness. After 2 or 3 days, if I don't get positive response, and then I change it to Avikiri. Okay. Yeah. Now from Stigdha, I think all of you know that the spectrum of Patrapotla Svedam. The common thing, Arkam, this thing, Avanam, what is that? Erandam, Nirgundi, Ung, Karanjam, Shigru, etc. that is taken up. There, there are some special areas wherein, only Nirgundi can be taken. If, only low back region, hip only is affected, Varattu Matenga, that is dry coconut, along with only, what is that? Avanaka, our Eranda Patram is taken along with dry coconut made into a potli and then potli. Chikitsa Manjari has that reference. Okay. So that is taken. So only Nirgundi and only Avanak, Erandam can also be taken, which has got more references in texts like Chikitsa Manjari. Otherwise, this combination is again told in Arogya Kalpadurgam, which tells about Shigru, Chinjarka Patram, Eranda Pallavam, etc. has to be mixed for a potali. The reference is from Arogya Kalpadurgam, which has been mentioned in Vatavyadi Chikitsa. The Jambira Vindasvedam, more of Stambha Haratvam, especially in the Urdhva Jadru, because it is more Ushna, Tikshna, this shoulder joint issues and hip joint issues, more Jambira has got more role. Okay. So I'll just move because I think time is, it's almost 9+ now. Then, some other clinically practiced thing is very heavy person with big, body size. Ishtika Pindasvedam. Brick is powder made into potli and then, it retains heat and it brings up that rukshata very quickly, especially in the thigh area and all. So that is practiced. Gairika Churna Pindasvedam. That is, Nakavi Manna. That is red, this thing, no? Reddish color of my mud, that is Gairikam. Acute inflammatory deformed joints, when they have acute pain, it is done locally only. It is just like powdered this way it is done. And it reduces pain 15 to 20 minutes. When we enter the theater, it will be all red because it is very sukshma, done generally locally only. Yeah. Now another one is avil kiri or prutuka, our rice flake, poha. Okay. So this is practiced in those cases, you move from kola kulattadi or cotton chukadi, you want to go for brahmana, but not as brahmana as shashtika. We are fearful of, some kind of kleda. So we need a more guru dravya, but at the same time, it should not cause hamatva. In that spectrum, we use this avil kiri or prutuka. Okay. It is added with dhanyamlam, 1 jambira we add little jada mayadi, make into a potli and do the procedure. Karisha Pindasvedam, dry cowdung powder is used in Samavastha. Okay. Kandari Mulaga Kiri. Kandari Mulaga is done in, this calcaneal spur area. Again, a spectrum of arthritic changes. acute inflammatory. Kandari molagga is very small chili, which is very potent, mostly available in, I think, Kerala and Tamil Nadu. It is added with little saindhava and made into a potli with little chincha, small. We ask them to dip it in OP level, dip it in muruvanna and do that. Naligera kiri, manjal kiri. Manjal kiri and Andapinda Svedam is mostly practiced in our tears, meniscal tear, not acute, chronic meniscal tear to strengthen the ligament. It has got more of Sandhana property. Application of Shastikam. In all those cases wherein, exclusively Sveda is contraindicated. But according to Avastha, we need to do a Sveda, like in Meha, Kushta, etc. Shastika, which is Snigdha Shita Dravya, we are using it for Svedana, that is applied. But at the same time, it is more Brahmana. So whenever, because of any chronic issue, there is joint, what do you call it as? Joint is weak and there is muscle wasting to an extent, or the strength of the muscle is less. In that case, towards the end, Shastikam can be a choice. You all know what is the gunam of Shastikam. Unlike the other rice that takes 90 to 120 days to grow, Shastikam is 60 days, takes only 60 days to grow. That is why it is more having more sthira guna. So that is why Shastika is used to do external therapies, unlike all other rice paste. Shastikam can be manipulated according to different conditions. Like, you make it very loose, it becomes Nyavara Dhara. In Shastikam, that Pakam is very important. The indication of Shastikam includes Vividamsta Nihanti Toda Beda Prabardin Vada Samudbhavan. Kurute Agni Balam Deha Pushtim Sharira Madhavancha. Yeah. And there are some special prayoga of Shastika. If the patient is intolerant to the pinda, the cool Shastika, which is more of that kind, Sataila Pindaspeda is done, wherein, oil is heated and Shastikam Pindam, same way it is dipped. I'm not going to the procedural details of it. That in such cases, stilling of body is prevented. If you have more of, what you call it as, more of, you see that muscles are wasted, there is more rukshata, there is thinning, etc. Shastika Annalepam is done. It is not more of Svedana, it is more Brahmana. Special Shastika Shveda, adding Ajamamsa, adding Ashwagandha along with Shastika, using Ajamamsa Rasa along with Bala Kashayam, etc. are done in those cases which have to be more Brahmana in the background. In thigh areas affected, instead of Shastika, practice of Goduma Palkiri or Goduma is boiled similar to Shastika and Balakashaya. Generally in upper thigh issues, it is practiced clinically. And in cases you feel that patient may have a kleda, patient may succumb to some kind of amavastha if only Shastikam is done, then Shastikam is added with Kolakulattadi. Churnam, and then Shastikam is done. Like that, manipulations according to our logic we can do. Yeah. So this is the reference from Chikitsa Manjari. Chinja patram tu samshunnam naligera samanvitam patraptam potali kritva tena svedam chakaret. Only chincha patram can be used. Then tandal urayum mulakkin avanakilayum varattu thengayumai. I told no, erenda patram and only thenga means coconut, grated coconut, that is specifically in the low back region. This is the reference from Arogya Kalpadrumam, which is actually the common combination of Patrabotla Sveda that now we are using. Shigru, Chincharga, Nirgundi, Varane, Erenda Pallave, Agnereva Tatsamay Chinne, Tailas Vinnehi in Vatavya Chikitsa. Yeah. So I'll just end the session with, acclaimed oils that we have to be using in different clinical conditions with a short basic understanding. In detail things we will maybe not in this purview. I think these are the commonest thylums that we can practice. Dhanandram, Kotanjukadi, Sajradi, Pinda Thailam, Muruvanna, Prabhanjanam, Chinjadi. Hedagi, Muladi, I think I have missed. And of course there are many, but we will just go through. So when we are thinking of a yogam, okay, whether it is Gridam, Thailam, etc., 3 or 4 things that helps us to understand the specificity of that yogam is, one thing is which prakarana that yogam belongs to. For example, Rasna Dashmula Gridam belongs to Kasachikitsa. Tiktaka Gridam basically belongs to Kushta. Dadi Madi Gridam basically belongs to Pandu. Kalyanagam basically belongs to Unmadam. This understanding we must have, because we'll have an understanding of that yoga's affinity towards where it has one. Second thing is we must have an idea of what are the main ingredients of the yoga. Third one is, of course, by hearting the yoga with all this indication, it may not be possible, but main ingredients. Third one is what are all the general indications of the yoga. Fourth one is there anything specifically told, uncommon or unmatchingly told in the yoga? Like, in Lashunakshiram, Grudrasi has been told. Mahadevans are always used to tell this. Okay. So, you have to be understanding. We'll never think Lashunakshiram Grudrasi. Okay. In Vaitranavasthi's indication, Clybium has been told. It is when lumbosacral plexus is affected. So like that uncommon thing will have a pathological indication there that will get us more clarity regarding its utility. Okay. Yeah. So let us think of Prabhanjanam Tailam. Okay. Balashadavari Sahasra Yogam is the indication. The importance of Prabhanjana Tailam is Pana Abhyanjana Nasyeshu, it has been told, Vidheyam Vasti Karmani. So one of the Tailam that has been told for Chaturveda Prayogam. Not all Tailams are told for Chaturveda Prayogam. Like Kotanjukadi is told for Totta Lottu Mudokum, external only. But Madhyashtadi, Mahanarayana, Dhanvandra, etc. are told for Chaturveda Prayogam. Similarly, Prabhanjanam is also told for Chaturveda Prayogam. I have practically used it for Vasti as well as Abhyanjana. Nasyam I have not done. In one or two cases internally I have given. See the specificity, Ashiti Vatajan Rogan, Vata Gulma Ardita Vriddhi Mantrajam, Vata Vidhradi, Muda Garbam, Tada Shulam, Vividamsta Vinashayet. So as I mentioned, those spectrum of joint pains which have been an output of Gulma Samprapti. Okay. Or Vidhrati, that Abhyantara Roga Margas involved in a Samprapti in a case. Or you have a case with knee joint or hip joint pain with all this Abhyantara Samprapti of Gulma, Vriddhi, somewhere in the spectrum you find, then Prabhanjana Vimardana Thailam is a choice for Abhyantara use, etc. Okay. Sahajradi Thailam, as you all know, there are two Sahajradi Thailam in Ashtanga Hridayam, Valiya Sahajradi and Chariya Sahajradi, big one and a small one. So this one is a smaller one, but generally Sahajradi Thailam is told. Here, Sahajradi, we must understand Samula Shakasya Sahajarasya. Generally, people say ki Sahajradi is for lower limb. Thinking of, Druda Vilambadigo Bhavadi Chaya, Sahajradi Kashayam's indication. But this is not that one. It is told in Vatavyadi Chikitsa. It is having Kshiram along with Sahajara is the most important, and it has got Dashamulam. Then, there are other things, Kushta, Himela, so all those, more of what you call it as Jalam, Savyam, Nakam, Kushtam, Sprik, Priyangu, Natamisi, Arush. It's like more of Ushna in nature. Okay. But to control that Ushnatam, Tulyak Kshiram is added. See, its indication is Tampa Akshepaka Stamba, Shoshadi Yugdan, Gulma, Unmada, Penasa, Yoni Rogan. So you could see a penasam also here coming to that. Okay. Gulma, Unmada, and then, Kampa, Akshepaga, Stamba, Shoshadi. So, all this Kampa, Akshepaga, Stamba, all these things are Snayugada Vikaras. So, Upadatu Janya, Snayugada Vikaras. So, that is why in Parkinson's spectrum, this neuropathy spectrum, low backache with all this neuralgic pain, etc., Sahajradi, which is generally Ushna in nature, is selected. Okay. Kotanjukadi is a Malayalam yogam, Sahasra yogam, Tottalottu Mudakku Madilum, Vadam Todadekadum, Chindipan. It is like, Kottam Chukku, Vayamba, Shigru, Lashnam, Kottam, Kushtam, Shunti, Vayamba, Vacha, Shigru is our Shigru, Lashunam, all Ushna Tikshna Dravyas are told. Siddharthagam is our mustard. Suvaha Marachu Tilajam Dadnacha Chinjarase. Along with Tilatailam, there is Dadi and Chincharasa. Chincha Swarasa is also there. And it just you touch it, it will be reducing. The pain will be Total Uttu Mudakkum. Udakkum means that which is locked. You just touch it, the locked thing will be, locked vayu will be corrected. I mean, wherever there is Tambatum, that is corrected. So we have to understand this. Its dravyas are more of Ushna in nature. So Vata Kafanu Bandha condition, Kotamjukadi is the best choice. And one of the common medicine that we use during this Varsha Kala. Okay, in Varshakala, Kottam Chukadi is very commonly preferred. See, Dhanvantaram, Balamula Kashayasya, Bala Tailam of Shariram. Okay, Balamula Kashayasya, Baga Shatpayastada Yavakola Kulattanam Dashamula Sanishkwato. So, Balamula Kashayam is main thing, and it has got Shiram along with that, and all this Brahmana Dravyas, Dvimeda, Kagoli, Dvaya Chandanehi, Shariba, more of not Ushna, more of, Shita Brahmana. मृद्वग्निना तैलं सर्ववादविकारजे सूतिका बालमर्म अस्ति हदक्षीणेषु पूजितं ज्वरगुल्मग्रहोन्मादमूत्रागाधान्ध्रवृद्धिजे धान्वन्तरमेव योनिरोगक्षयापहम्. So all it is, more of, Shosham in the background, all Sukumaras, more of Brahmana, not as Ushna as Sahajaradi. That is the spectrum. Okay. Pindadailam, as you all know, Vadarakta Rujapaham. So, Raktanubandhatvam. Only 3 dravyas are there. Chinchadi Thailam, there are again 2 Chinchadi Thailam. Valiya Chinchadi and Chariya Chinchadi. In small Chinchadi, only Chincha Patra Swarasam and Kalkam is Shigru, Sarjarasa and Pancha Lavana. So, wherever Shofam is there and we need a hygroscopic thing, there Chinchadi has got a greater thing. So all this ONE with, effusion, patellar tap, positive, etc. Those cases, Chinchadi is the added. Chinchadi is a better choice. Kotamjukadi is during rainy season. Chinchadi is for a chronic pain with swelling. Chinchadi is a good choice. Ketagi Muladi, Ketagi Mula Bala Ati Balanam Yat Balena Rasena Vipakvam, Tailam Analpam Tushodaka Yuktam, Marutam Astigatam Nihanti. So specific affinity towards Astigada Vayu. So Kedagi Muladi is a preferred dravyam for all our bandharas. We do Kedagi Muladi Thailam added with Mahasneham. You do bandage to knee joints. All that's third case lady is there, no? I mean, second case, varus deformity. In that varus deformity lady, our observation is grade 4 plus OA. It is very difficult for us to treat or even reduce pain. She has to be moving on with the support only. So if she is able to, their demand is, I can move with a walker, doctor, no problem. You just reduce my pain. I will not move independently on the knee. Then we will be able to do that. But if they want to move independently with knee, grade 4 OA, without support, it will be difficult for us. But grade 3, grade 4 pain, we can reduce. But when again she starts walking, the pain will come back. With full varus. Up to grade 3, we'll be able to do. Generally, getting admitted, start with Ruksha. If Amanubandha is there, then Abhyangam, Vasti, 3 or 4 Vastis, followed by Janvasti, Shashtikam. This is the common thing that we see. Abhyantara, and then regular use of Kedagi Muladi, Mahasneha Bandhana, with internal Maharasnadi, Rasne Randadi towards end, added with Sajradi, Thaila, or Gugulu Tiktaga, Indukanta, Grita kind of spectrum. Okay. Chinchadi, Valiya Chinchadi is the big one. This is, Chincha has got, other than Chincha Swarasam, many other things. It is more, Valiya Chinchadi acts in a more deeper way. Okay, Jambira, Shatapushpa, Grinjanaka, Amla Shuktan with the other ingredients are there. So when we compare two yogas, the yogam that has got more dravyas in our limited clinical understanding, more dravyas have got more systemic action. Okay, Guru yogas. Lagu yogas will have act at that level. Okay, but that action will be super. The other thing, it has got a Guru yogas with many ingredients will have a systemic. You will have to observe at different levels where it has been indicated. Generally in market available is in normal Chinchadi. I think 1 or 2 pharma has got Valiya Chinchadi and Chariya Chinchadi. Then Bala Ashwagandha Lakshadi as end as Brahmana Madhyashtadi, that Vadaraktam spectrum, it is Madhuratikta Shita Dravyam. Mahamasha Thailam is a Ushna Brahmana Thailam, which can be, whenever there is Thamba in the background. And it is kind of, it is Balya too, at the same time Ushnatvam is there. So Mahadevan sir always used to say about this Mahamasha Thailam towards the end. If you have Vataka Phanubandhatvam throughout, but you need to give Ushnam. So it is Ushna Brahmana Thailam. Mahanarayana Thailam, whenever there is Shosha, Mahanarayana is again a Thailam which has got Chaturveda Prayoga. So you can use, it is more of Vata Pitta Shamana and Balya, more of Vrishya Rasayana kind of thing. It can be used as maintenance thing for aged individuals. I think to conclude, in management OA, we have to use the full potential of these Kriya Krama. How can we use? By understanding the basic tenets behind, the principles behind their utility, moving from Ruksha to Sneha to Sveda, Ekanga, Ardhanga, Sarvanga. Understanding Kriya Krama, Bahiparimarjana Chikitsa can fasten action. Quick results if applied only with specificity, especially for Bahya, Madhyama Roga Marga, Bahya Kriya Kramas are relevant. We have to keep in mind the medium of the dravyam, the drug that we are choosing, the physiology of the patient, and the pathology in the background. The way of execution, like how long we have to do, the speed, pressure, temperature of Potli Sveda, how many days we have to do, 30 minutes, 40 minutes, these things have to be standardized. I think we have to practice judiciously with sense and sensibility, cost effectively for the patients. Yeah, thank you.
Thank you, ma'am. Thank you so much for such an wonderful and insightful lecture on this particular topic of osteoarthritis. Thank you so much, ma'am. Before entering into the discussion, we have got a presentation from Dr. Sharath, Medical Officer, Dr. P. Alikutis, Ayurveda Pharmaceuticals Cortical, regarding the list of medicines. So I request everyone to listen to that. And I welcome Dr. Sharath, Medical Officer from Dr. P. Alikutis, Ayurveda Pharmaceuticals, for the presentation. Welcome, Doctor. And I request everyone to wait. The session is not over. We will have the discussion after this presentation.
Our products. Okay, I want let get you bored. We will go to the presentation now itself. Okay, we are Dr. P. Alikutis, Ayurveda Pharmaceuticals, Kottakkal. We are located in the serene nature of Maravattam near Kottakkal. Okay, we are Z, GMP, ISO, and FSS accredited. Then this is our factory. We have more than 400 plus classical medicines, including Kashaya, Arishta, Asava, Churna, Taila, Grida, Lehya, Arka, and 40 plus proprietary products. We are into this manufacturing since 1965 along with our hospital, and we also do third-party manufacturing. Okay, now we will go to some products related to the topic. Okay, the first one is Pain Clear Ubanaha Churnam. The ingredients are Rubia cordifolia, Alpinia galanga. Tephrosia purpurea is nothing but Sharabunga, which is called Korinil in Malayalam. Then Singiber officinal, Soseria costus. Actually, the yoga is, the action of the yoga is Kabavadahara. So in every initial stage of the disease, we can use it as Leba as well as Ubanaha. We recommend to apply it with the honey as it contains Tikshna medicines like Sharabunga. Okay. The mode of action is anti-inflammatory, antioxidant, and analgesic. Okay. The next product is Pain Clear oil and balm. The ingredients are, it contains most of the oils along with the volatile oils, then to get the penetrating action, and some Vada Kabahara drugs like Kundurishka, Shundi, Kushta, etc. Then it also contains bird's eye chili, which is Kandari Mulaga in Malayalam, which has also the penetrating effect. Okay. It also has the same mode of action, anti-inflammatory, antioxidant, muscle relaxing. The indications are stiffness, muscle pain, joint pain, backache, headache, sprain. Okay. Now, Amaclear capsule. As you know, in osteoarthritis, in the name, it seems to have inflammation. But actually, in other inflammatory arthritis like RA or ankylosing spondylitis, there will be first inflammation, later there will be degeneration. But in case of osteoarthritis, what happens is the inflammation will be in the later stages of the disease. Okay. So the combination is Chandamartha Sindhuram and Vyoshadi Vadagam. Chandamartha Sindhuram is a Siddha medicine which has Tridoshara property and Tikshna action, and also it will help to take the medicines deeper into the dhadus. And the Vyoshadi Vadagam is a Vadaka Baharam. Okay, so we can give it as anti-infective, anti-inflammatory. Actually, what is the difference between anti-infective and anti-inflammatory means any inflammations caused by bacteria, virus, or yeast, it is called as infection. So the medicines against that infection is called anti-infective. All the infections are inflammations, but all the inflammations are not infections. Okay. Then it also promotes the metabolism in cellular level. Okay, so it can take the medicines up to asti dhatu. Okay, the mode of action is an anti-inflammatory, analgesic, bronchodilatory, antipyretic. Okay. The next one is our capsule, that is stability capsule, which contains Boswellia serrata extract, that is Kundurishka, and Comifera mugul extract, that is Gugulu. And also because of the Tikshna Guna, there is a chance of Pitta Vriddhi. For that, we are adding Godandi Pasma. Okay, it is purely indicated in osteoarthritis. As you know, the most commonest site is knee joint. Next one is the base of the thumb. Okay. It is completely anti-inflammatory. That is Vata Kabaharam. Okay. Now Ruja capsule. The combination is Hinguvajadi Churnam, which is Vata Kabaharam. Then Sudarshana Churnam, that is Tridosharam, and plus Boswellia serrata. In this also there is a chance of Pitta Vriddhi, so we are adding Godandi Basma to avoid the stomach disturbance. Okay, the indications are relieves musculoskeletal pain, anti-inflammatory, anti-arthritic. Then we do have some special kashayas. The Mustadi Marma Kashaya and its capsule is our proprietary medicine, which is mainly indicated in the Marma Bigadaja Rogas, in any sprain. That is, sprain means any discontinuity in the ligaments or in a fracture, in the healing process of fracture, we can recommend Mustadi Marma Kashayam. The capsules are also available. Then we have the Shimula Rasnadi Kashayam. Okay. And also we do have Vadachura Haram Kashayam, which is our proprietary medicine, which contains Bala, Guluji, Devadaru, Trikadu, Patya, Haridra, etc. It is also used in the Amastha cases. Whenever there is an inflammation, acute inflammation, we can recommend Vadachura Haram Kashayam. And we do have many other kashayas like Pachanamrita Kashayam, which is indicated in Samapitta and Kaidaryadi and some special kashayas. Okay, even Shundi Baladi Kashayam we can use in Stambam or in the Suptivadam. Okay, this is a small introduction about our products. Thank you.
Thank you, Doctor, for the presentation. We can get back into the discussion part. Hello, ma'am.
Yeah. Hello, I'm here. Yeah.
Okay, ma'am. We have got certain questions in the chat box.
Yes.
Ma'am, one question is, can patient apply oil for overnight? Doctor is asking from in Gujarat, as it is a dry area.
Yeah. Actually, if we think of the textual references, there is a book in Kerala called Vaidya Manjari, which describes about various possibilities of Abhyanga. In that book, there are references from 12 hours, it has been told. So you can decide accordingly, I feel. I mean, if it is very dry area and the patient is Vada plus in that condition, in that case, if you apply just oil and ask him to lie down in the evening and get back in the morning, it won't be an issue. So you just to do that. Textual references are there up to 12 hours. Okay, in practice. Okay. So here in Kerala also, there are references like Meena Masam, Midhuna Masam, all this month. you have to apply it for 2 yama, up to 4 yama. And there are differentiation, you apply, leave it for how long. So it is not, when we are doing Abhyangam, we are doing it for 30 minutes, no? So the text refers, it's not doing for 30 minutes. You just apply it and leave it for 3 hours. So Abhyangam for 3 hours means it's not just doing a manipulation for 3 hours. You apply, leave it for 3 hours. Like that practice is also there. So that is, we cannot negate it. You do observe and then conclude according to your locality. I think that will be the best thing to do.
Okay, ma'am. Ma'am, next question is the use of Triphala Eranda and Nimbamrita Eranda.
Triphala Erandam, I don't know. What is it? Nimbamrita Erandam? That is Nimba Amrita, means Nimba Amrita Vrishapadola Nidigdigana. The 5 dravyas of the first 5 ingredients of Gugulu Tiktadam. Erandam is processed in these 5 dravyas, which is more of Tikta, Pachana medicines are processed with Erandam. We use Nimbamrita Erandam internally if there is more Vata Kafanubandham. And you have to go for, Tikta Pajanam with special reference to, Gulma Samprapti, with a special reference to all this PCO spectrum of things, wherein you could see Gulma Vidhriti Vriddhi spectrum of medication internally as Erandam. And then commonly used in Nimbamrita Erandam is for Talam, because it has got, again, preventing the Kapha Vilayanam in the Shiras. Triphala Erandam, I don't know.
Okay, ma'am.
To clarify whether Erandam, if it is processed with Triphala Churnam, I don't know. I think commonly used Erandam in our practice is Gandharva Erandam, Nirgundi Erandam, Nimbamrita Erandam, Sukumar Erandam. Then Hingu Trigunam has got again Erandam. Other thing I'm not aware.
Okay, ma'am. Ma'am, next question. The ligament tear, the rotator cuff tear due to Vada Pitta Prakopa due to stress Rukshahara. I think Dr. Ujjala is asking the Abhyantara Prayoga in that, Abhyantara Kalpa.
Ligament tear, you mean to say, it's
Yes.
ligament tear or rotator cuff tear, 2 different. Ligament tear, knee joint, rotator cuff tear, the shoulder joint, rotator cuff tear, it has to be like more thought of as apabahukam. Okay, it will have involvement, not just like ligament tear of the knee, which is more on strain. This will be a part of chronic inflammatory response. Like, you have a Kleda Samprapti in the background also, you will get it. Abhyantara Snehanam in both the cases. In ligament injury, generally we go for 2 things. One is Sahajrati Thailam internal. Second one is Indukanta Grudam and Gugulu Tiktaka Grudam. These are the Abhyantara Snehapana we use. For shoulder joint pathology, if you are telling about rotator cuff, there we use Prasaranyadi, which has got more Prasaranyadi and Kubja Prasaranyadi Thailam, which has got more affinity towards Urdhva Jatru Vikara. So there, Rasne Randadi Kashayam with Prasaranyadi Thailam is used. For knee, Rasne Randadi Kashayam with Sajradi Thailam is used. Like that, differentially it is used.
Okay, ma'am. Ma'am, other question, which all conditions of osteoarthritis we cannot treat in Ayurveda, such any conditions?
As I mentioned, this grade 5 osteoarthritis where the patient is having severe pain even on rest and she's not able to do anything. I think surgical is the option. The second one is septic arthritis. We have to be very careful because that may lead to other kind of sepsis and all. So of course, it is inflammatory. We have to be careful. Like the patient will be having high grade fever. It will not be controlled in that stage. Those things with my limited experience will not be able to manage it properly.
Okay, ma'am. Ma'am, next question. On what basis do we select Dhanvantara Thaila and Mahanarayana Thaila? Any specifications with respect to signs and symptoms?
Yeah, definitely. Because, Dhanvantara Thailam is actually told in Sharirasthana, Sutika. Mahanarayana Thailam, Sahasra Yoga Vatavyadi. Mahanarayana Thailam has got special affinity towards, that infertility spectrum of internal use. Dhanvantara Thailam has got a special affinity towards Garbhasti Marma Vikaras. So all this Marmasti Vikaras, Dhanvantara Thailam as Brahmanam. Mahanarayana Thailam more as internal utility. And you could see the ingredients of both are different. Mahanarayana Thailam has got more ingredient. Dhanvantara Thailam has got majority Bala Moolam as a major ingredient. So Mahanarayana Thailam is a more of what you call it as more Guru Yogam when compared to Dhanvantara Thailam. So all this Shataja Vikara or Swabhavika Vada Vikara, like age related or because of some degeneration, Dhanvantaram is preferred. But Mahanarayana Thaila's indication, you see, it has got so many indications more specific. There, you could see what you call it as systemic diseases, like, Shosham because of a systemic disease, like you have MND case, or you have a chronic neuropathy, or you have a chronic foot drop. All those things because of systemic issue, the Shosham has happened. In such cases, Mahanarayana Thailam is preferred.
Okay, ma'am.
Yeah.
Ma'am, next question.
Yeah.
All oils are contraindicated for AMA. Should we use Dhanyamala in all cases when patients come in OPD first time with pain conditions or AMA stage?
Oils are contraindicated means, see, certain condition, cotton jukadi murvana we can apply. But vata has to be more, no samavastha should be there. In all samavastha, Dhanyamala can be a best choice, no doubt.
Okay. Ma'am, one other question is
Yeah.
internal use of Kedagi Muladi Thailam, internal usage.
I have not practiced. I have done external only, internal I am not aware. Since it is told Asti Majjagadavadam, not specifically told that internal or external, we may try. Kotanjukadi Thailam internal use is practiced. In the at Cortical Ayurveda College, CTS for CTS, carpal tunnel syndrome, Kotanjukadi Thailam was given internally and the patient had responded positively. There was a study as Shamana Snehapana. So generally in practice, what we say, all those ganams that has been told in Shodhanadi Gana, like Aragodadi, Eladi, etc. At the end, it has been told that it can be used for Pana, Vastina, Abhyanga, Navana, etc. All other yogams like Rasna Saptagam has been told with the Nagara Churna Mishram for internal use. Okay, so like that, what has been told in the yogam can be understood. Since Kedage Muladi only Asti specific had been told, we can think of using it internally, but I don't have any clinical experience.
Okay, ma'am. Ma'am, another question, it's a broad spectrum question. Chikitsa for meniscus and ligament tear, then fresh tear and all tears.
Tear, see, the practice as I mentioned, acute tear, grade 1, grade 2. If the patient is able to walk with the pain is severe, not completely tear, then we have to give complete rest. This Chenyayagam, that is our Kumari. Dried Kumari is Chenyayagam and Motteda Vella. What is that? White egg, eggs white. It is promaced into a paste and it is done as a marmalade, and acute complete rest has to be given in the initial stage, at least for 3 weeks if it is acute. Regularly bandages has to be given, and internally Laksha, Gugulu, Mustadi, Marmakashayam, Punarnavasam, Punarnavadi, Nadi Kashayam. These are the things preferred in the initial stages. After that, again Lepam, Kartavatta, Lepam, no manipulations have to be done. At least after 1.5 months only, simple manipulations to improve the movements we have to be given after the healing happens completely. After that, we'll be able to strengthen the muscles and all with the Jambira Pindasvedam. Initial stage, we can go for Anda Pindasvedam, Mottakiri we call, when scrambled egg is heated with what is that? Jambiram, added with the Shatapushpa, some Sandhaniya Gana that is added and made into a potli like that, and then followed by Shashtikam. So it is like a long-term management avasthana avastha. Initial 1.5 month, no manipulation except lepam, bandage, internal medication.
Okay, ma'am. We are getting questions out of the topic also, but due to time constraints, I am picking only the questions related to the topic. Ma'am, if you doubt meniscal tear, first degree, what labors or oral medications that can be given?
I told no, even similar meniscal and ligament are approached similarly. I am not, not having much clinical experience in doing many such cases because I'm a general this thing and I do neuro specialty over here. So both meniscal as well as ligamental tear, almost the same principles are applied. As far as my understanding is there, the same thing that I told. Mustadi, Punarnavadi, Punarnavasavam, Valiya Marmaguliga with the milk, it is given internally. Then externally, lepam and bandages are given.
Okay, ma'am. Ma'am, what are the Aharaja Nidhanas that should be avoided for OA patients?
See, generally, Vata Kopanida means Vata Kara Aharas that would aggravate Vayu in the Koshta. That has to be avoided. Like, all those gas forming food, Guru Ahara, those things that happen in below the earth. We say Cucurbitaceae family kind of things. That hanging things, no?
Yes,
Muskmelon, that this our all those things are more Akasha Vayu Guna dominant, which hung in the air. So
Yes.
Cucurbitaceae family kind of, what is that? Our Kushmandam, our what is that? Cucumber. Okay. So all that spectrum of cucumber or cucumber as we say, and that Kushmandam, snake guard, our bitter guard, Karela, all that happens in Cucurbitaceae family has got more Vayu. It is Vayu Akasha Guna. It is not of more Guru Guna. So it supports basically helps in the metabolic thing. So it is supportive. So all those we call it as Bhumi that grows below the earth. It is more Guru, like the Alu, tapioca in Kerala, those things just have to be avoided. And all those our gram varieties, among that Masha, which is Ushna Snigdha, it is good for Vata Vyadhi. But all those black, what is that? Horse gram, Bengal gram, spectrum, which again, it's not good. Mudgam green gram is good. And I think other than content, which is Satmya to them, most important is time of food intake. Late night dinner, having non-vegetarian heavy food at 9 o'clock, 10 o'clock at night, then sleeping at 11 o'clock is a bad thing for all cases. We must have food before at least 7:30 in the evening. At least 2 to 3 hours before our sleep, we have to have food so that digestion happens, except in Pitta people who may have lot of appetite during night. Otherwise, this has to be the pattern. So time of, usually females, they take bath in the afternoon. They have late breakfast, late dinner, late lunch. So those things have to be corrected. Along with the food items that they are Satmya too, we cannot generalize, but we can generally, Vata Kopa food, we can be avoided. Pitta Kara, kind of sore, achars, that that in Kerala we have something like what vinegars, they keep it in vinegar and eat food along with in the afternoons, right? So that we call it as surke litvachasan, vinegar kind of, that is more vidahi in nature. Those things have to be avoided.
Okay, ma'am. Ma'am, one more question. Can we cure knee joint with bend and pain after 60?
After 60. Knee joint pain we can cure, definitely. As I mentioned, no, that Kshiravasti followed by Janavasti, definitely pain will be reduced. We have to ask them to regularly use bandage with the Kedagi Muladi or Mahasneha. Once in a year, IP treatment. This we can continue.
Okay, ma'am. Ma'am, I think we can stop the discussion here. Thank you so much, ma'am, for the wonderful discussion. And we have Dr. Rahmatullah sir with us, the Chief Physician, Dr. P. Alikutis, Ayurveda and Modern Hospital, Cortical with us. I invite sir to add a few words to the session. Hello, sir. I think there is some network issue. Meanwhile, we have got one more question. Highlights on Tiktaka Shiravasti. Ma'am?
How can we use Tiktak Shiravasti?
Yes, ma'am.
Kshiravasti can be used in two ways. One is like, the classical Kshiravasti. Kshirad dau prasrudo, madhutaila grita, trayaha khajena madido vastir vadagno balavarna krita. So Kshiram, that is 1 pala of medicine, 250 ml of water or 300 ml of milk, 4 times, 1.2 liters of water has to be boiled and reduced to 300 ml. And then Kshira is 2 prasartha, Madhu, Taila and Grita. These 3 are 1 prasartha each. So on an average, 120 ml of Madhu, 120 ml of Taila, 120 ml of Gritam with 250 ml of Kshira is mixed in the order, added with Saindava. Kalka is generally not added. Okay, so in that way, Kshiravasti is done. Makshigam Lavanam. So there are 2 Snehas. Makshigam Lavanam, Sneham, Kalkam, Kodam. No? That Sneham has got Gridam as well as Thailam. So we use Lagu thing initially. So Gridam is added, then Thailam is added. Like that, that order of mixture goes on. You can also modify, like, the Madhu Taila Vasti, Madhu Taila Samekarsha, Saindava, Dvibijurmesi, Erenda Mulak Vadena, that Vasti Yogam. In Madhu Tailika Vasti, Erenda Mulak Kashayam can be modified as Erenda Mulak Shiram. Then Madhu and Taila Sama, Grida need not be added. Because, Grida is like if the patient is having some Kleda Avastha, Ama, something set up and can set in such doubt we can modify Madhu Tailaga into Kshira, Madhu Taila, Shatapushpa can be added and that way also is done. Technically, Kshiravasti that has been told us, this Madhu Kshira Dau Prasada, which is more Brahmana. So 2 ways you can practice Kshiravasti. Panchatiktaka Kshiram is the common thing. Nimba Amrita Vrisha Pradola Nidigdiganam I had told, no? That is the Vasti, the 5 dravyas that are made into powder and that powder is used 1 pala to make the Kshiram. Yeah.
Okay, ma'am. Thank you. As already the session is overdue, but still we are getting questions. I think we can wind up the session, isn't it, ma'am?
Yeah. Okay.
Okay.
Sure.
Thank you. Thank you so much, ma'am, for the wonderful session. It was really very insightful. And for the kind discussion in patient in answering all these queries. Thank you so much, ma'am. And I once again like to invite Rahmatullah sir to add a few words. I think there is certain network issue there. So I request everyone to wait for a few seconds. And meanwhile, I request participants to give the feedback for the session in the chat box. So that's really very important. So I would like to call upon few names. Already we are getting questions like, will the recording will be available? Actually, we have planned. It's a one-time watch session. Definitely we will discuss this matter. And thank you all for joining us here today. And I request few doctors to unmute yourself and give the feedback for the session. That's really very important. I will call upon set. Hello. Yes, doctor.
Yeah, it was a very wonderful session, and thank you, ma'am, really from it was so in detail and very informative. Thank you very much.
Thank you, doctor. Thank you so much for the kind words. And I wish one or two doctors to come forward to give your feedback. And already we are getting good feedbacks in the chat box, and it's really very delighted to see all this. Okay,
hello, ma'am. As always, it was a wonderful session, excellent session, I should say. Ramya ma'am's session before also I have attended. Wonderful session. Thank you so much.
Thank you, doctor.
Hello, namaste, madam. And it was a wonderful session and practical experience of what madam shared has given confidence to the young doctors. Thank you, madam, and thank you, team.
Thank you, doctor. Anyone wish to give the feedback? Welcome. Actually, really, your feedback matters to us. So it's really very valuable. So, and very happy to see the good feedbacks in the chat box also. And I wish one more doctor to come forward and unmute yourself and ask. Give your feedback. Recording says I am getting messages. So as I said before, we will discuss that matter definitely. It's this feedback will be considered.
Hi, ma'am. Really, it's a wonderful session and it's very informative. As I'm attending the first time, really, I'm very satisfied to attend this session. Very thank you, ma'am. Thank
Thank you,
you so
doctor,
much.
thank you, doctor, for the kind words. Thank you all for the kind words, and we are really very delighted to see all your feedbacks and your kind words. And we have Dr. Rahmatullah sir with us, Chief Physician of Dr. P. Alikutti's Modern and Ayurveda Hospital at Kottakkal. And I would like to invite sir to the session to add a few words. Welcome to the session, sir.
Good evening, everybody.
Good evening, sir.
First of all, thank you, Dr. Ramya. You are a good discussion about the osteoarthritis. Very good session. You approach all of the. Hello, hearing?
Sir, audible.
Yeah. You touch all the part of the arthritis. Thanks to your good session. It's a 2-hour session. I know Dr. Ramya from. She studied in the Kottakkal Ayurveda College. I am also work with her. She's the chairman of those college. I'm a secretary. So I know she is a very excellent students that time also. So I again congratulate you and give our regards, Dr. Ramya, and all the participants and the second session of Anubhava. This is a good starting of the Ayurveda map. So I am also congratulating Dr. Jasul team. Okay, we can continue this session every month. I accept all the support from all the audience and all doctors. Okay, thanks. Good night.
Thank you, sir. Thank you so much for the words. It's really added to the session, the grace. Thank you so much, sir. And I think we can wind up the session. And it was a very wonderful session. Once again, Ramya ma'am, thank you. Thank you so much for the wonderful and insightful session. It was really very interesting and very nice to hear from you, ma'am, regarding the topic. It was very well explained and was very interesting to hear. Thank you so much, ma'am, on behalf of entire team of Ayurveda Map and MedMap. Thank you, ma'am.
Good night, all.
Good
Namaste.
night, all.
Thank you.
Good night, ma'am. And thank you all the participants for your patient listening and for the wonderful feedback. And we look forward for the upcoming sessions also. And please look on to the updates regarding our sessions in the group. So thank you all. Good night.